My exceptionalities presentation is on hearing impairments, including deafness. IDEA's definition of deaf is a hearing impairment that is so severe that a child is impaired in processing linguistic information through hearing with or without amplification that adversely affects the student's educational performance. The textbook definition of deaf is a deaf person is one whose hearing disability precludes successful processing of linguistic information through audition with or without a hearing aid. And then for hearing impairment, according to IDEA, the definition is an impairment in hearing, whether permanent or fluctuating, that adversely affects the child's educational performance. And then the textbook definition of hearing impaired is a person who is hard of hearing, generally has residual hearing sufficient to enable successful processing of linguistic information through audition with the assistance of a hearing aid. When an individual is diagnosed with a hearing impairment, there are three different types of hearing impairments that an individual could have. The first one is a conductive hearing impairment, which is the failure in the transfer of sound in the conductive pathway of the middle of or outer ear. And then we have a sensor and neural hearing impairment, which is hearing difficulties in the inner ear. And the third one is a mixed hearing impairment, a combination of conductive and sensor and neural hearing impairment. And then if we look at the image below, the purple part of the ear that is shaped like a shell is called the cochlea, which is the primary part of the ear that relays sound throughout the ear to the brain from outer noise. To determine if somebody is eligible for a hearing impairment disability, there are three different tests that can be performed. The first one is a screening test, which is for infants and children. It consists of measuring autoacoustic emission, which is when the cochlea receives and emits low intensity sound when stimulated by auditory stimuli. The measurement of the autoacoustic emissions determines how well the cochlea is functioning. And then for older individuals, the next one is a pure tone audiometry, which determines the individual's hearing threshold at various frequencies and is measured in hertz. Hertz is the number of vibrations per unit of time of a sound wave. An individual's threshold is the level of hertz in which a sound can be detected. And the third test that is used is the speech audiometry, which determines the individual's detection and understanding of speech and the required decibel level. A common way to perform the SRT assessment is to present a list of two-syllable words and what decibel is required to hear the words, and each ear determines how impaired the individual is. So if we look at this chart, it shows the different decibels and the requirement that it takes to hear each individual sound, according to the last assessment that we discussed. So at mild is when an individual's education and academic and learning may start to be affected from having difficulties in classroom discussions, not being able to hear classmates or understand conversations, no matter if it's loud or in a quiet setting, and the effect that it has on the individual's speech and if it's intelligible or not. So next we're going to talk about the academics and learning for hearing impaired students and individuals, the different strengths, needs, challenges, and what interventions are available. To begin, for strengths, parents who are also deaf are able to communicate efficiently with their children using American Sign Language, which breaks barriers in relaying information. And children with deaf parents are also likely to be fluent in ASL, which can translate in learning written English and reading. Some academic and learning needs that hearing impaired people have are members in the deaf community believe that general education classes are not beneficial for hearing impaired or deaf students, and many within the community believe that students benefit from being immersed in a school system with students that have impairments similar to each other, which facilitates an effective learning experience. And later on, we're going to discuss how this also has an effect on their social life. And then academic and learning challenges are the big question of should deafness and being hearing impaired be considered as a disability? According to IDEA and the ADA, there are several different accommodations and rights and responsibilities that the school system has when it comes in the form of what hearing impaired students are entitled to. If not, should the world of special education honor the belief that some individuals in the hearing impaired and deaf community believe that they don't have a disability? Many hearing impaired students have major deficits in academic achievement, especially reading proficiency, which requires the English language. By high school, many hearing impaired students are 5 years behind their hearing peers. Although research suggests that the difficulties that hearing impaired students with mild to moderate inner ear hearing loss face are similar to phonological and phonemic awareness of students that have reading disabilities. And this makes sense because the link between hearing impairment and phonological and phonemic difficulties is logical, given that phonology, by definition, refers to the sound of language. So one intervention that could help for academics and learning is getting a cochlear implant. If you look at the image below, you can see that the internal coil is wrapping around the cochlea and then it's attaching to the external coil outside of the ear, and connecting those together produces sound to the brain. With a cochlear implant, it serves in setting a foundation for intense early intervention and structured routines and learning. And through cochlear implants, teamwork abilities are available with their non-impaired peers since they're able to hear them. And it provides specific interventions and auditory verbal learning. Next, let's discuss the debate on collaboration. Although collaboration of hearing impaired and non-impaired individuals may have prevalent academic benefits, there is major controversy within the deaf community. By some within the deaf community, it is believed that collaboration and immersion into the hearing community can cause individuals to lose their deaf identity and influence them to adopt the culture of the hearing and speaking environment around them. When hearing impaired individuals are the minority in the non-impaired community, they are likely to suffer socially. Two reasons why they may suffer socially is a lack of peers that they can openly communicate with and a high level of social isolation, which can lead to emotional development issues. Although collaboration can have various impacts on students depending on school-based support from peers and educational personnel, and which collaboration can have a remarkable effect on academic achievement. So overall, for some students, full integration is the most beneficial method, although for others, a separate setting is best due to the accessibility to inclusive education programs. And the next intervention is assessment for student progress. The use of sign language and explicit instruction is utilized to support phonics-based instruction is an effective strategy in teaching reading and writing. In order to determine the effectiveness of the use of instruction, assessments must be continuously given to track progress and student outcomes. Curriculum-based measurements are used to monitor progress in fluency and comprehension when reading, math, and with written expression. The STAR Reading, Math, and Early Literacy Assessment is also commonly used to monitor a student's academic growth. Although the assessments are computerized, and that provides immediate feedback and data on a student's skill set that will assist with instructional planning. The National Center on Student Progress Monitoring evaluated the effectiveness of this assessment and the data produced and found that the assessment is extremely rigorous. However, some professionals believe that these assessments may not be appropriate for students with hearing impairments. Most assessments are designed for the majority of the population rather than the minority when it comes to hearing ability, and that must be considered when reviewing data. Although it is important to use assessments to track data on students. And then for testing accommodations, due to state standardized tests, it is crucial for testing accommodations to be implemented. So some accommodations include sign language for directions and test questions. Although these two accommodations can be considered non-standard because it affects the scoring and interpretation of the test. Then we have extended time, small group or individual testing setting, and signing responses to test administrators. So next, we're going to discuss the physical and sensory strengths. The first strength is hearing impaired students are likely to be strong visual learners and able to manipulate visual information, for example, looking at an image and maneuvering the image mentally. Next, we're going to discuss the challenges that hearing impaired students face physically or sensory. The sense of hearing is one of the most important senses along with sight. And moving around the world safely, impaired hearing is also a risk factor for falls and complications with physical activity in general, due to difficulty with balance and walking ability. Due to the stress that physical activity can bring to hearing impaired individuals, especially when not assisted by someone or an assistive technology, physical activity is oftentimes avoided completely by many within the deaf community. However, physical activity is important for maintaining good health and prevent complications in health when getting older that could have easily been prevented through an active lifestyle. So to assist with physical and sensory challenges, one need that is prevalent is a cochlear implant. Cochlear implants can help to enhance safety for the hearing impaired community when moving around. Although there is major controversy in regards to whether cochlear implants are physically and culturally invasive. According to professionals that oppose the use of cochlear implants, using the technology can cause a lack of exposure and practice with using American Sign Language, which allows for open communication with other deaf individuals. One intervention that can be used to help with the risk of falling is that experts within the deaf community suggest that the practice of balance exercises such as Tai Chi, along with physical therapy, can help in promoting balance to prevent and minimize falling risk. So next, we're going to discuss the communication and language strengths, challenges, needs, and interventions. With intentional exposure for strengths, sign language is easily learned by children within the deaf community. Hearing impaired individuals develop in sign language at an equivalent rate as individuals learning spoken language from the babbling stage, 1 to 2 word phrases, and complete statements. Previously, professionals in oral language development believed that the spoken language of individuals who are deaf was a sign that intellectual deficiencies were present. However, after further research and development in the study of communication and language, American Sign Language upholds a substantial amount of features that are similar to spoken languages, such as grammar rules. So when discussing sign language, there are a few misconceptions. It is believed that sign language is not a true language by some. Sign language is a primitive visual representation of oral language similar to mime, is frequently stated by some that do not understand the purpose of sign language. This belief was challenged by linguist William Stokoe, stating that comparable to the phonemes of spoken English, American Sign Language has 3 essential parts, which solidifies that ASL is more than miming. Another challenge is that one challenge is comprehension, language production, and speech of the English language as the most critically affected area of development for hearing impaired individuals, which is the predominant language spoken within the United States. There are various factors that contribute to the intelligibility of speech. One is the degree of the hearing impairment, and the next one is when the hearing impairment was acquired. Developmentally, learning a spoken language is more difficult when the hearing impairment is acquired earlier in life. Individuals who are congenitally deaf, so born deaf, face more difficulties in developing a spoken language than those who are adventitiously deaf. So that means deafness acquired in a period after birth, which varies from 18 to 12 to 6 months of age. When it comes to challenges for non-English speaking immigrants, many immigrants face challenges in communication and the English language when first arriving in the United States. Although being deaf increases the challenges faced within a school setting when attempting to teach a second language when there are deficits in knowledge of the primary language already. A communication and language need that many hearing impaired students require is that when teaching deaf individuals to use language, there are two strategies that are used frequently. The first one is oralism, which is teaching those who are deaf to speak, and manualism, which is using manual communication. Most professionals in communication and language suggest using a total communication approach, which includes both oralism and manualism. However, recent studies support that the total communication approach is inefficient for complete language development, and there should be an increased focus on a bicultural and bilingual approach, which promotes American Sign Language as a primary language to support the instruction of individuals while including the deaf culture. One method that is used is finger spelling to spell the English alphabet and to spell certain words. So the first approach that's also commonly used is the auditory verbal approach. The auditory verbal approach relies on hearing amplification technology, such as hearing aids and cochlear implants at a young age. By using the amplification technology, the language learner will be able to utilize the use of the audition to improve speech and language skills. However, the sound produced by the technology is not identical to what is heard by the naked ear, and explicit instruction must be implemented on how to produce appropriate speech. The next strategy that is used is the auditory oral approach. The auditory oral approach is a visual method which includes speech reading, using visual information, and cue speech using handshakes for specific sounds. Individuals using the approach are also able to identify facial expressions and positioning of the jaw, tongue, and lips to determine speech in various situations. So the exclusive use of the oral approach is frowned upon by many professionals due to the lack of focus on sign language for deaf children. Educators should not assume that hearing impaired or deaf students have enough level of hearing to be used for the approach. And next we have the bicultural and bilingual approach as another intervention. Although several variations of the bicultural and bilingual approach exist, most contain these three features. The first one is ASL is considered the primary language and the English is considered the secondary language. Next, people who are deaf play an important role in the development of the program and its curriculum, and the curriculum includes instruction in deaf culture. And then last, for communication and language, there are technology advances that can be used to help with communication and language. Technological advances assist hearing impaired individuals in communication and language within the hearing world. The technological advances include hearing aids, captioning, telephones, computer-assisted instruction, and the internet. The technology also helps enhance literacy skills of children who are hearing impaired. Next, we're going to discuss some of the daily and independent living challenges and strengths and interventions available for daily and independent living. Unemployment and being given fewer opportunities is one of the greatest challenges for hearing impaired individuals. Even when highly qualified, individuals have significant problems, um, especially women. Many employers are not aware of the accommodations for employees with hearing impairments and what a hearing impairment entails. Individuals with disabilities also do not frequently advocate for themselves and have trouble making good career choices in which they can excel. Although there are strengths in daily and independent living for hearing impaired individuals that can help with the challenges. There are different activist groups, so the deaf community does an exceptional job of advocating for all members of the deaf community in the United States, even when they can't for themselves. And focus areas to ensure individual human rights are social, educational, and medical policies. Two organizations that are best known for advocacy within the deaf community are the Gallaudet Deaf President Now and the Unit for Gallaudet Movements. One intervention that helps with daily and independent living is that recent studies and evidence suggest that the controversy of hearing impaired discrepancies within the workforce is beginning to take a shift in a more positive direction. The main reason for this change is an expansion of post-secondary programs for students with hearing impairments. Recently, the federal government has begun funding post-secondary programs specific for hearing impaired individuals. The two best-known programs to service individuals with a hearing exceptionality are Gallaudet University and the National Technical Institute for the Deaf at the Rochester Institute of Technology. But although many go to these two deaf majority colleges, some hearing impaired students elect to attend more traditional colleges. Many colleges within the United States offer accommodations for hearing impaired students, such as interpreters. So for behavioral and or social strengths, challenges, needs, and interventions, the first one for strengths is that the deaf community and culture helps to foster a sense of belonging and identity for the hearing impaired. Many within the deaf community are being deaf. Deaf communities see being deaf as being a part of a minority rather than a disability. The key factors of deaf culture are linguistic differentiation, so being bilingual, attitudinal deafness, so what an individual classifies as being deaf. Some individuals that have lower decibels may consider themselves as being deaf or hearing impaired more than somebody that's a higher decibel. Behavioral norms, which is norms in the deaf culture versus hearing culture. Endogamous marriage. So 90% of marriages with other deaf people is 90%. And mixed marriages are oftentimes frowned upon. It, historical awareness, so valuing elders within community and their wisdom and knowledge of the deaf tradition, and voluntary organizational networks. One of the challenges in behavioral and or social for the hearing impaired community is many deaf children struggle with interacting with their peers and struggle with finding others to build relationships with. Deaf children, when not surrounded by other deaf children, oftentimes are at risk of loneliness and self-esteem socially. Some professionals also believe that deaf individuals who have hearing parents are at higher risk of being unhappy than their deaf peers who have deaf parents. The most prominent reason for this is that hearing parents are not usually proficient in sign language, which prevents them from effectively communicating with their children. 90% of children who are deaf have hearing parents, which makes the problem even bigger. So some needs are prevalent for behavioral and or social issues in the hearing community. non-hearing community is when discussing the topic of deafness, it is important to take an optimistic view in which the impairment is seen as a gain rather than a loss. As similar to other known exceptionalities, a hearing impaired individual abilities outweigh their disability. So some interventions for behavioral and social is cooperative learning. Cooperative learning helps to increase positive interactions between the hearing impaired community and others without impairments in hearing so that there is easy access to be able to communicate with peers that are hearing and not hearing. Another intervention is having deaf culture and history within public school settings. Many professionals believe that involving individuals from the deaf community to develop classes in deaf history and culture within general education populations helps to foster an inclusive environment that highlights the achievements of the deaf community. So in the education setting, I feel that as an educator, it is important to consider that students with hearing impairments will have delays in learning due to not being able to hear the information being taught. Effective strategies can be used by general education teachers to accommodate students with hearing impairments, such as preferential seating, sign language interpreters, extended time with instruction and assessments and assignments, repeated or paraphrased instructions, and assistive technology. And here are my references.